Yes. Okay. Pause. Stop recording. Okay, so it is recording. I would hate to go through all this and then not record it at the end. All right. Well, so let's start this then. So good morning, Mr. Matt. My name is Gratiana. I'm a nurse practitioner student, and I will be conducting your psychiatric evaluation today. Can you state your full name for me, please?
Sure. My name is Matt Smith,
Matt Smith. And what is your date of birth, Mr. Smith?
April 1st, 1993.
Okay. How old are you?
32 years old.
32 years old. And what gender were you at birth?
Male.
Male. And you identify as what?
As male as well.
As male. Okay. How would you like me to address you?
Matt's fine.
Is it okay to call you Matt? Perfect. Okay.
Absolutely, Doc.
Are you married?
I am.
Yes. Any children?
Yeah, I've got three kids.
Okay.
They're
All
really
right.
excited about Halloween.
I can imagine. What do you do for work?
So I work at a restaurant. I've been working as a manager there for the last couple of years. It's tough work. It's tough work. Not the biggest fan of my boss, but we make do.
Mhm. Okay. And do you live here in West Palm Beach?
Yeah, yeah.
Yeah. Who do you live with? Your wife, your children?
Yeah.
Anybody else?
We all live together. No, it's just
Mhm.
us.
Just okay. And who referred you to me?
Well, my wife said that I needed to see something, to see someone about my drink, and she thinks I got an alcohol problem, so she kind of made me come here.
Okay. And how do you feel about that?
Yeah, I don't really think I drink that much, especially compared to some of the other people at the restaurant. I mean, you should see them. So.
Mhm. Yeah. Okay. So, if you could tell me in your own words, not thinking of what your wife said and why she thinks you should come and seek help. Why are you here? What are you hoping to get out of this visit or to accomplish?
I mean, I'm mostly just here to make her happy. She's been, worried and nagging me all the time about how I drink. So if it doesn't make her happy, then sure, I'll do it.
Okay. So, and what insurance do you carry?
Aetna.
Aetna. Okay. Aetna. Very good. Okay. So, what are some of your current stressors in your life? I know you mentioned you work in a restaurant business. I imagine it's very stressful. You're on your feet all the time. You're dealing with customers and staff, call outs.
Yeah. The finances have not been good. I just the it seems like ever since the pandemic, it's tough on everyone, right? And then we're
Mhm.
no exception. So, and when you got three kids, you got a wife who doesn't work, you're the only one providing. You got to do a lot to keep. So I'm working 6, sometimes 7 days a week. And so when you get home, you just want to relax, you know what I mean? So, but then when you come
Mhm.
home, the kids got things to do, and the wife, she won't leave you alone, and it's just, it's tough. It can be tough, man.
Um, do you talk to your wife about these things? How do you feel about these stressors and the financial burden that you have to carry?
I mean, how do you think? It sucks, right? But what can you do? If money needs to be brought on the table, you're the one who works. You keep working until you're provided. That's how I was taught.
Mhm.
So And I
And
don't
how does your wife feel about this? Would she be willing to contribute, maybe to find a job and help you out, or have you discussed this with her at all?
No, no. I mean, it's that ain't her place, right? Like she's got enough going on with the kids. Like my dad, he took care of everything. He was always the worker, so mom didn't have to. And
Hmm.
same thing with Gramps and his family. So I feel like this is something I got to do on my own, right?
Okay. How old are your children?
So they're all about 2 years apart now. So they're 12, 10, and 8.
12, 10, and 8. And what are they? Boys, girls?
The boy, girl, boy.
Boy, girl, boy. Okay. So I know you're financially stressed out and you don't really have much for yourself anytime, but what do you do for fun? What do you do for yourself, if anything?
I mean, mostly sleep, right? But I mean, there was a time when things weren't as hard. I used to play trumpet. That was fun. It was I wouldn't say I was any great shakes at it, but it was nice. It was nice something to do. Uh, Fishing, when you
Mhm.
can. I mean, we're probably the best state for it. And sometimes I'd love to just get on the water, just you enjoy the nature. You catch something, you don't. It was nice to be there, but you don't really have a lot of time to do it with your one day off, or something. You just kind of sleep,
Mhm.
So I haven't really done that in a while. Maybe one day.
Has anything changed in the last couple of weeks, months that put an additional burden on you or your financial situation?
Nah, not Doc. It's nothing like I don't know. It's nothing big. It's just been I don't know, like a death from 1,000 cuts, right? Like you get a car problem. A kid needs something for a project. You got to get a plumber because of a leaky faucet, and just one
So
thing
just
after another. It all kind of adds up. So I wouldn't say
life.
anything big.
Okay. So just life. Okay. All right. So you said that your wife feels that you have a drinking problem. So tell me more about that.
I
What's
mean.
happening?
I don't really know what else there's to say. She thinks that I drink too much. I don't think I do, but
So how much do you drink?
I mean, about as much as the next guy, right? I mean, I'm maybe drinking like six, maybe a couple more in a day.
What do you drink? What's your choice of alcohol?
I mean, it's
Beer, wine, liquor, like what do you or
beer's the easiest thing to get a hold of.
hmm
So it's usually just a 6 pack or whatever's on sale at the liquor store. You pick that up and you're set for a little bit.
hmm So would you say you drink about 6 beers a day? Is it every day?
Yeah, yeah, it's six, maybe a couple more.
Maybe more, like between 6 and 10?
6 and 8 a
Six and
day.
eight. Okay. So
Yeah.
about 6 and 8 beers a day. And is it daily, you said, every day?
Yeah, yeah. I mean, you drink a couple at work, you drink a couple when you get home, and just you can't space it out on the day. It's not gonna drink them all in an hour, right?
Right. And how do you get to work and back home?
I drive myself, right? I got the truck, so we get there and back just
Mhm.
fine.
Okay.
Yeah, in a very far drive, it's maybe like 10, 15 minutes, 20 if
hmm
it's bad traffic, but
Okay. So you said that you mentioned that you drink at work, right? And you have a
yeah.
couple of beers at work and then you drive home like
Yeah,
that?
but I mean, I'm fine. I'm a good driver. Like, it's
Okay.
like not it's not that big of a deal.
Okay. How has your mood been lately?
Um, it's fine, right? Like I'm been holding on best I can, It's tough. It's tough. I don't not as happy as I once was, I guess. But with everything going on, what can you expect? So I don't know, it gets kind of down in the dumps.
And so, if I ask you what way or how do you cope with this financial burden that's on you and the lack of support, financial support, how would you tell me, or what do you think is your coping mechanism with this?
I mean, you just bottle it up, right? You don't think about it. You watch something, you drink a little bit, and everything kind of gets numb. And then when you wake up, you just face the day. Just take care of whatever's the next thing in the way.
Okay.
So that's fine. We've been getting through.
And have you ever felt helpless, hopeless,
I
not worthy
mean,
enough?
uh, I guess, yeah, kind of. It's tough, right? Like, I don't know. I feel like I'm giving it everything I got, but like, I don't know what. I don't really know what else I can do besides, you pray that things go your way, and I don't know. You just hope things work out. But I'm starting to lose that hope, Doc.
Hmm. So, how much does the situation interfere with your life, with your everyday life? Are you able to eat? Are you able to sleep? Are you able to function?
I mean, yeah, I can function fine. I mean, you eat what you can, you sleep how you can. You don't really get to see the kids as much as you'd like, or talk to the wife as much as you'd like, because just dealing with other people's problems at work, and then you come home, you got to deal with, "Well, I need this for my school project. You got to stop drinking." So then you just kind of want to shut yourself off and go to sleep, and
Mm.
you can go from there, right?
Have you lost or gained any weight recently?
Nah, nah. I mean, it's a little bit of weight gain, but it's just like it's normal, right? Yeah, it's not like I'm
How
going.
much is little?
It's
What
I
do
don't
you
know,
consider little?
like 10 pounds,
So
something
you
maybe
gained
last
about
month or
10 pounds? Okay.
yeah, like last month or two, something like that.
Mhm.
I'm not really. It's not like I got time to exercise or anything like that. So, it's you deal with it.
And how many hours of sleep would you say you get a night?
I don't know, like 6, maybe. I don't know.
Okay.
Sometimes when I'm drinking, I just kind of lose track of time. You just kind of wake up wherever you were, and at least the alarm wakes you up, and then you go. So I don't know, that probably helps me sleep a little bit more.
Okay. Do you have any nightmares or night terrors or flashbacks or anything like that when you sleep?
Nah, nah. You just it's just black. You go to sleep, and you wake up, and that's about it.
Have you ever been in the military before? Are
Nah,
you a
nah, never,
veteran? Not a
never
veteran?
served.
Okay. Okay. So your stressors, your main stressors is just the financial situation and being tied up at work literally 6, 7 days a week. Have you noticed anything that makes it better, the situation? If
I mean, the drinking.
you're
You,
drinking.
you feel better drinking. Like you don't
Hmm.
think about it as much. You just can kind of enjoy the buzz, enjoy the ride, and then when you wake up, you're and you shake a little bit. You don't really want to go to work. You don't feel as good, and then you take a drink, and shakes go away, and you feel a little bit better. And you're able to
Hmm.
go to work. So. It's just the drinking helps. Some people say it ain't good for you, but it's working for me. So
Have you noticed any changes in your energy level, your motivation level, your concentration, your focus?
no, I mean I can focus fine at work. No one's ever said anything about me like slipping or anything like that.
Mhm.
I've maybe gotten a little angrier
Mhm.
at work or stuff. You know, the boss, whenever he checks in, he says I got to work on the attitude. But I mean, easy for him to say in his cushy office. You know what I mean? Just like he doesn't get it. So I don't know. I guess that
Mhm.
upsets me. But otherwise, you don't want to take it out on the kids. You don't want to yell at them. Whenever I argue with the wife, we try to do it behind closed doors. I don't want them to see it,
Mhm.
but it's hard. It's hard not to yell at her. So, especially when
You
she's
said you're
doing my
32
kids.
years old. When did you start drinking? Is this something new, or you've been doing this for a while?
Nah, alcohol and me, we go back. Family, they drank. There was all the get-togethers. It was fried food in one hand, it was beer in another. So I started drinking, I guess high school. I don't know, 14 and so.
Since
Yeah,
14? Okay.
yeah. You wouldn't drink on the school days, but when the weekends come, you'd get out together with some friends, or if the family gatherings were happening, you'd drink. You keep on drinking and see how much you could hold, right? So,
Mhm.
and I went to college. Then, that was like, kid in a candy store, right? You're seeing parties left, right, and center. You could drink as much as you wanted there. Um, and then I don't know. I guess my grades started slipping. I got in trouble that one time, and then I don't know. That after my DUI, they told me that I had to go to a program, and
Mhm.
that helped. That helped. I was after the program, I was sober for a while. But then I don't know. I
When
guess.
was the DUI?
Uh, I don't know, what was sophomore year? I guess I was like 23 at the time. So
Mhm.
yeah,
And
yeah, yeah. But I don't know. I guess I was over for a while, but then I don't know, what was pandemic, I guess, 2020.
mhm.
That's when things got bad. Uh, you know, we had to move, couldn't afford the rent, you know, and started working more, started drinking a little bit, and then it just kept going.
Well, thank you for sharing this with me. I appreciate it. So, you said that at 23, when you got the DUI, you went to a program. How long after finishing that program were you able to maintain sobriety?
I mean, I guess do the math, right? It was 5 years ago. I would have been 30, no, 28, 28 at the time.
So for 5 years,
So,
maybe?
uh, yeah, it sounds about right. And I'd have to do the napkin math. It's kind of hard for me to concentrate these
Mhm.
days, but
Okay. So you maintained sobriety for 5 years. That's very good.
yeah,
That's
thanks.
very good.
Yeah.
So, how long is it safe to say that you've been in this pattern of 6 to 8 beers daily for the last 5 years? Is that safe to say?
I mean, we didn't start there, but it
Just
picked up.
gradually.
Yeah, it's like riding a bike,
Mhm.
you get those habits and they come right back. So I don't know,
Okay.
maybe I was probably back up to the 6 or 8 in like after a year or so.
Mhm. Okay. Any other substance use history, current or present or past?
Uh no, it was just drinking is all,
No THC, no cocaine, no opiates, benzos, nothing like that?
Nah, I don't touch stuff.
Okay.
They that I don't really think it's right to use.
Okay. Do you smoke cigarettes or vape?
Nah, nah. I uh I don't do that. I don't do any of that.
Okay. So, for psychiatric history, have you ever been seen by a psychiatrist or the psych nurse practitioner, or any ever hospitalized for psychiatric issues, Baker acted, or any therapy?
I don't really know what a Baker Act is, but no, I did the program, right? You know, after the DUI, the folks made it pretty clear, like you gotta do something, and I don't know. I think that scared me a bit, so I did the
Hmm.
program, right?
Hmm.
It was like you had to stay there. It was like a I don't know. You stayed in a place for a bit, and they sobered you up. And after the program, I was didn't touch stuff for a while. You know, ignored the
Hmm.
family gatherings and all that stuff. So that was pretty good. You know, met the wife a little bit afterwards, so that was nice. And you know,
During the time when you were drinking and you had the DUI, were you court ordered to go to treatment, or did you just do that because you felt that it's the right thing to do?
I mean, little A, little B, like they definitely told me to do it, but I
Hmm.
if they didn't, I think I would have. It was I don't know. I was kind of out of control then.
Hmm.
So
Okay. So, are you familiar with withdrawal symptoms? I assume, right? Like, so, what withdrawal symptoms, when you don't drink, what withdrawal symptoms do you experience other than, tremors in the morning? You said that before, get your day going, you have to have a drink to stop the tremors, the shakes.
I
You're
don't know if that's
angry.
withdrawal. That's just how it is, right? You know, just
Yes, those are withdrawal symptoms. Those are
there.
withdrawal symptoms, yes. Changes in the mood, being angry, irritable, lightly irritable, and easily irritable, I should say. Those are all just some of the withdrawal symptoms. Have you ever had any seizures that you know
No,
of?
no, nothing like that.
Okay. Okay.
Just a little bit.
Do you have any tremors now?
I mean, like a little. And,
A little.
that
Okay.
that's not like water. You know, this is just water. It's not vodka or anything like that. You know,
Hmm.
I wasn't gonna start drinking before we talked.
Any headaches?
A little, nothing I can't handle. You know, you take a Tylenol or so and you'll be
Hmm.
fine.
How bad is it, like the pain, from 1 to 10? How bad would you say it is?
Like moderate, I can handle it. You know,
Like a 6, maybe 5, 6?
yeah, it seems right. Something like that.
Okay. Okay. Any sweats or chills?
Nah, yeah,
Okay.
nothing more than normal, right?
Nothing more than what's normal? I mean, it could be normal for me, maybe it's not normal for you, or the other
Yeah,
way
it's
around.
just like when you go outside, right? Like I'm not sweating or
Hmm.
shaking. That's not the tremors when I'm indoors, right? So no chills
Hmm.
there.
Any nausea or vomiting?
No, no vomiting in the morning. Sometimes if you drink a little too much, I don't really
Hmm.
remember all of it, but you see some stains on the toilet, and you realize maybe you went a little hard. But
Okay. Any diarrhea or constipation?
nah, nah, I'm regular.
Um, so no other substances other than alcohol consumption, right?
Yeah, just the one,
Mhm.
that's fine.
Do you drink coffee or energy drinks?
Nah, nah.
No. Okay. And you went to rehab only one time?
Yeah, I mean if that's what you want to call it.
Hmm.
Yeah, the just the one time.
One time. Okay. All right. So I would like to do a assessment to see it's an assessment for alcohol misuse. So I'm going to ask you a couple of questions, and you can answer to the best of your ability.
All right.
Um, so four questions, really. That's all it is. Have you ever felt that you should cut down on your drinking?
Uh, I mean, yeah, I guess family member. He was my uncle, right? I love the guy, right? Like he
Hmm.
was close. You know, he's the one who actually taught me fishing and stuff.
Hmm.
Uh, well, when he passed, they said that the drugs, the alcohol, they had a lot to do with it. And sometimes I wonder if I'm following in his footsteps.
Hmm. Okay. Have you ever became annoyed by somebody who criticized your drinking?
Yeah, yeah, I'd say I get pretty annoyed with the white snagging. Yeah.
Okay. Have you ever felt guilt about your drinking?
I don't know, Doc. I guess. Yeah, I don't know. I mean, it'd be nice if I didn't have to, but
Okay. The last questions. Have you ever had a morning eye opener to get rid of the hangover?
no, it's not a hangover. Really, just a little headache, little shakes. You know, and drink that, and you're fine. I don't know, that count?
Yeah.
Eh, then yeah, I guess so.
Okay. All right. So, going back to your family history, I know you told me that your uncle, you were very close to your uncle. He taught you fishing, and he had a drinking problem and also using drugs. What other history of substance use disorder do you have in the family?
I mean, uh, dad, dad drank. Dad drank a lot. And you know, grandpa, grandma, both of them drank a fair bit too. I mean, I told you, family gatherings, a lot of
Hmm.
alcohol there. So,
Okay. And this is on both sides, mom and dad side, like both parents.
I mean, I don't really know my mom's grandparents.
Hmm.
They passed before I was born. But dad's grandparents, yeah, both of them were drinking.
Drinking. Okay.
Yeah.
And you said your uncle was doing some substances too, illicit drugs. Like, do you know what?
Nah, they didn't really ask, and I'm like thinking of them like that.
Hmm. Do you have any siblings?
Yeah, I got a brother and I got two sisters.
Hmm. And do they have any issues with alcohol or substances?
Nah, or if they do, they're better at hiding it than me. So,
Okay. Okay. How about mental health? Any history of mental health problems in the family? Your grandparents, your parents, your
uh,
siblings?
I mean, grandma, she was always real down on herself. You know, locked herself in the room, didn't really come out, you know, wouldn't really engage in things, was crying all the time. So I guess she had depression, but no, otherwise we were fine.
Hmm. Anyone else besides your grandma with
No one
mental health?
else, no one else. I mean, do you count learning disabilities?
Yes.
Then you know my youngest, he's he tries, but he just doesn't pick up things that well.
Hmm.
Like hard for him to read and stuff. And
Hmm.
I think the psych doc diagnosed him with ADHD. Guy can't sit still worth a
Hmm.
day, but you know, the put him in front of that video game, he'll sit down, you know what I mean?
Do
So,
you have that issue to focus? You have a hard time focusing or staying
nah,
still?
nah, please with the amount that I work and the things I got to do, I don't think I could be able to handle it. I had his problem. I don't know. Maybe got it somewhere on his mom's side.
Okay. What, if any, medical history do you have? Any medical conditions that I should be aware of?
Um, I've been watching my blood pressure. Got one of those like home cuffs.
Mm-hmm.
Yeah, they're saying that I was borderline hypertensive, and it's just been getting up there. I think my last one
Mm-hmm.
was like 150. Hold on, let me look at the thing. Like 158 over 98. So
Mm-hmm.
I think that's kind of high. He said like if you get to like 160, watch out. So
Mm-hmm.
and then
And
last year I got diagnosed with diabetes. My A1C was at like 8, so I'm on metformin for that now. So
okay. And what do you take for blood pressure?
nothing yet. He said it was borderline. So like, cause
Mm-hmm.
if I can hold off on the pills, I will, right? So
Mm-hmm. And who's he? Is it safe to assume that that's your primary care physician?
yeah,
That's a,
yeah,
okay.
yeah. Dr. Stevens, he's a great guy.
Dr. Stevens. Okay. Mm-hmm. Dr. Stevens. All right. How long has it been that you've seen Dr. Stevens?
I see him like once, like maybe every 6 months or so, maybe a year. It depends on things. It's been about 6 months right now.
6 months that you've seen him? Okay.
Yeah,
And what was the last blood pressure you had when you were with Dr. Stevens?
I don't know. I don't know. I'd have to go look
Hmm.
and see. I don't know. He said it was.
Has
He
your
said it
blood
was
pressure, because
worse.
you said you've been checking it at home, his blood pressure, your blood pressure has been going up since then?
It's been like pretty consistent 140s, 150s.
Hmm.
158's a little high. Um,
Okay. Are you allergic to anything?
Nah, nothing I know of.
Okay. And besides the metformin, are you taking any medications?
No,
Any other medications or over the counter or supplements or
I mean, I guess I take Tylenol right for the headache, but
mhm,
yeah, that's really about it.
that's it. Okay. Any family history of any family history of suicidal attempts or suicidal ideations?
Yeah, yeah, my uncle. Um, we didn't know it at the time, but
Hmm.
yeah, he killed himself.
Oh, it was suicide. I'm so sorry to hear that.
It's all right. It's been a while.
Have you ever thought of harming yourself or ending your life?
Uh, I mean, I guess you're just gonna come out and ask me. Yeah, yeah, a couple
Okay.
times. I don't know when you when you when you're left alone with your thoughts, you lock yourself in the room, you drink,
Mhm.
things get a little dark.
Have you
Uh,
ever had any attempt to end your life?
I'm I've never done it. I've never done it, but one time I did it was real bad. Um, they I was thinking about what's the best way to do it, something not that messy, something that wouldn't hurt. And I thought about going out to the garage and just start the car and you can go to sleep and you know but I didn't do it. I didn't do it. I thought about it, but
So you thought about it, but you didn't act on those thoughts.
right. No, I couldn't. I couldn't. I got too many people relying on me. It
Hmm.
wouldn't be right.
And how long ago was that?
I don't know, couple maybe a year, maybe 6 months. Time gets a little fuzzy.
Okay. All right. So I'm going to ask you a couple of questions. And I just want to do a screening for you for just to assess your suicidality or your ideations. In the last 30 days, have you ever gone to bed wishing that you're not going to wake up the next day?
Yeah, yeah, I guess I have.
Okay. Okay. In the last month, in the last 30 days, did you have a plan on how would you end your life?
No, no plan. Just hoping that I don't know, like that God do the job for me, right?
Hmm.
Killing yourself's sin, that's how I was raised, Catholic and all that. But I don't know, sometimes I wish he'd just do it for me.
Hmm. So you had no plan. My next question would have been if you had in the last 30 days, if you had any intention in acting on those plans. But since you had no plans, the answer is
No,
no.
no.
So, and one more question. In your lifetime, have you ever done anything, in preparation to end your life? For example, you started collecting pills to overdose. You gave away your valuables because you weren't planning on being around to enjoy them. You started
No,
getting a
no,
gun so anything like that ever.
no. Again, I had the plan when I was, but I don't know. The more that I kept thinking about it, the more scared I got.
Hmm.
So,
Okay. So, uh, I'm gonna ask you again a couple of questions just to see how you feel. If you have any anxiety, any depression, anything like that. If I were to ask you, do you feel that you have depression or anxiety? What would you say?
uh, I mean, I feel down, um, and I have stress, but I wouldn't say I got either of them.
Okay. Okay. So, on a score of 1 to 10, or 0 to 10, 0 being no depression, no anxiety, 10 being the worst ever, you would say you score 0 on both of them?
I say zero on anxiety. I guess I got a little bit I don't know. Let's call it like a three for depression. I
3
guess.
on depression. Okay.
Yeah, yeah. If I think
Okay.
about things, I get sad. But, it's easy not.
So, the next couple of questions, 7 questions, it's the answers are not at all, several days, more than half the days, or nearly every day. Okay. First question, you feeling nervous, anxious, or on the edge? Not at
I
all, several days, more than half the days, or nearly every day.
um I don't know what's like a little bit above zero. Maybe once or twice I'll feel on edge, but that's more just like when the wife keeps talking to me about the drinking, like it's the one thing that helps, when sometimes we get in an argument and I'll tell her that like if you keep doing this, I'll just like what's the point? I'll just kill myself, but like I don't mean it. I don't know. Does that make that help answer
Mm-hmm.
your question?
Yes.
Okay.
Um, not being able to stop or control your worrying.
Zero. I'm not a worrier. I can
Okay.
stop, focus on
Worrying too
that.
much about different things. Would that be a
Nah,
0 too?
yeah, I'm not that
Okay.
worried. Not worried about stuff.
Do you have any trouble relaxing?
Without the drinking?
Yes.
Yeah, yeah, I'd say it's
Nearly every day?
yeah, I'd say it's pretty hard
Okay.
without the bottle.
Becoming easily annoyed or irritable?
Uh, yeah, yeah,
Nearly every day?
yeah, yeah. I guess
Okay.
that's true.
Feeling afraid as if something awful might happen?
Nah, I'm not that
Not
worried.
at all, or just every now and then?
Nah,
Not at all. Okay.
nah, I don't get scared.
Okay. Do you find that you have trouble relaxing?
Oh yeah, again, without
Yeah.
the drinking, yeah, yeah, I'd
Yeah.
say so.
Nearly every day?
Yeah, yeah, I'd say
Okay.
so.
Okay. All right. So that would be, all right. So your anxiety, based on the assessment I did, you scored a 10. 10 to 14 is moderate anxiety. Okay.
Really?
Yes. So 10 to 14 is
Hmm.
moderate anxiety. And I would like to also do one more assessment with you, and this is for the depression. Okay.
All right.
Again, the answers are not at all, several days, more than half the days, or nearly every day. Okay, and this one has 9 questions. So, do you find that you have little interest or pleasure in doing things?
No, no, I mean, please, I'd fish if I could, but
Hmm.
it's just life getting in the way, you know?
Okay, so not at all.
Yeah, I'd say not at all.
Do you feel down, depressed, or hopeless?
Yeah, yeah, I guess I do.
Mhm. Nearly every day?
Yeah, yeah, I guess so.
Okay, okay. Trouble falling or staying asleep or sleeping too much,
Nah, nah, I can wake up and go to work, and I can fall asleep.
even without drinking, or
Uh,
that helps you fall asleep.
well, I mean, if I'm gonna be honest with you, Doc, I don't think I've ever tried to fall asleep without the drinking, and not in a while anyway. So,
Okay. Okay. Um, Feeling tired or having little energy.
yeah, yeah, but that's for the job, right? I mean, that sure, yeah, nearly every day or whatever, but you know, you work hard, and you work
Hmm.
hard.
Poor appetite or overeating.
Nah, I eat fine.
So not at all, or just maybe just once in a while.
Nah, not at all. Not at
Not
all.
at all. Okay.
I mean, good. Maybe too much.
Feeling bad about yourself or that you're a failure or have let yourself or your family down.
It's kind of heavy topics, but yeah, I guess you know, I'm worried that I ain't doing right by them, by the kids, by the wife, I guess.
Okay. Trouble concentrating on things such as reading the newspaper or watching TV.
Nah, I can
Not at all.
maybe like
A little
once
bit.
a day. Yeah,
Okay.
but usually I
Mo
can focus.
Moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you've been moving around a lot more than usual.
Nah, nah, I don't think
Not
so.
at all.
Not at all.
Okay.
I don't think so.
And the last question, thoughts that you would be better off dead or hurting yourself in some way.
Yeah. Um, Not like every day, but I don't know, maybe like
More than half the days?
yeah, I'd say maybe more than half the days.
Okay. Okay. So let's see. One, two, three. Mhm. Yeah, so you scored for the depression screening. You scored a 15. Okay. So moderate depression.
I guess that makes sense.
Do you have any legal problems at the moment?
No, no. I'm square. I'm good.
Okay. Have you experienced any mania? Are you going out spending money on
N-
unnecessary items?
with what money, right? No, I'm good. I'm good.
Hmm. Um, any history of hallucinations, auditory, visual, tactile, any kind?
No, no. I see just fine. no hallucinations.
Have you ever been diagnosed with any eating disorders?
No, no, never.
So, just to go over the scores. So what I did the CAGE assessment. It's called CAGE, CAGE, for to assess how how your drinking habit is. If you actually, um, if you do have a drinking problem, and you responded yes to every single question. Okay, so and what I'm concerned with is that you already had a DUI at 23, and you were asked to go to a detox facility to rehab to seek help for your drinking problem. And it seems like the stressors in life and everything that's happening, you managed to stay sober for 5 years, but then you started drinking again. Um, so what it seems as though you're trying to self-medicate yourself with alcohol to get through the day, to get some sleep. You don't remember when you had the last time you had a good sleep without having a drink to help you to get to sleep. Is that correct?
Yeah, look, memory's just been a problem, right? Like I don't remember some nights, sometimes the wife tells me things and
Hmm.
I don't always remember them. So yeah, I guess I don't remember things.
Do you have a history of blackouts? Like you drink
Yeah,
to the point where,
yeah, I'd say so. Like I said, sometimes you drink and really you just kind of wake up wherever you were left off. You instead of making it to the bed. So
mhm. And for the anxiety, like I said, you scored a 10. 10 to 14 is considered moderate anxiety. For the depression screening, you scored a 15, which is moderate to severe depression. Um, so I would like to discuss, I would like to discuss some treatment options for you, if you are interested in considering them. And I do think that um, I do think that you drinking is a concern for your health and for your safety, being that you drink at work and then you drive. You already had a DUI. So, how do you feel about that? Do you think it's safe?
I mean, it's drinking and driving is more dangerous, sure, than not drinking and driving. But I figured I was fine, right? Like that it wasn't that big of a deal. I'm older now, than I was then. I can drive better. I can handle the alcohol better.
Hmm.
So, but I guess it can be dangerous.
Right, right. Are you operating any heavy machinery at work?
Nah, nah. I'm a restaurant manager. It's
Manager. Okay,
most
okay.
heavy machinery I do is the the computer. So.
Hmm. Okay. So, have you had ever any history of trauma,
Uh, yeah.
emotional, physical,
I mean,
sexual trauma?
Nah, nothing sexual, but like I don't know, like my uncle, him dying from the suicide, that that kind of sucked.
Yeah,
That was I don't know, you carry that with you for a while. I think that might have helped me start drinking a little bit more, um, not think about it as much. And then uh, my best friend, well, we were gonna go to college together. He died from heroin. Took too much of it one day, and um, that was it. So it's part of the reason why I don't touch the stuff.
I'm sorry to hear that.
And it's all right. It's been a while.
So besides the financial stressors, how's the housing situation? Do you own the house or are you guys renting?
We're paying rent. I'm paying rent, and landlords like to take their fair share.
Hmm.
So,
Okay. Do
but
you have
we're
any
we're making
support
it.
system available?
Uh, I mean, y- man's an island, right? Like, don't want to tell a wife. The only thing she wants to talk about now is how I'm drinking too much, and don't want to bother the kids. Don't like involving the family. So, and I can't really. I don't got time to go anywhere. When I do, I don't know. You just don't want to like talk to people, right? Like I get nervous talking. Drinking helps settle nerves. It always has. It's how I met most of my friends in
Mm-hmm.
college and stuff. Is that if I didn't drink, I just felt so nervous I couldn't talk to them, right? So, it's hard to go out and meet people. So now I'm handling things by myself, you know. And I don't know, it just doesn't feel right going back to church. I haven't been there in a while. So I don't know. Don't think I'm ready to, you know, confess, go
Um,
to confessional and all that.
so based on my assessment, I do believe that you have a problem with alcohol.
Hmm.
Okay. Also, depression and anxiety seems to be going hand in hand. And you seems like you use alcohol to self-medicate, to just kind of like you said yourself, to numb yourself. And so at this point, I'm not sure because you're drinking, you stated that you're drinking every day. When you stop drinking, I'm not sure how you do with everything, like how your depression would be, how your anxiety would be, even your sleep and your appetite. So what I would recommend, and I know you said that you're only here because you wanted to make your wife happy. You don't think you have a problem, but based on the things you told me, it's I think it needs attention. It needs attention, and the sooner the better. But of course, you're the one to determine if you're gonna if you're gonna do that or not. Um, I would like you to go to treatment and for alcohol detox, to safely detox off of alcohol, to make sure that you're not going to have seizures, you're not going to have anything, and then which is about 7 to 10 days.
Uh,
Medicate.
so I gotta go somewhere for 7 to 10 days.
I would recommend, yes, I would recommend an inpatient detox program.
Um, so I don't know if I can do that with the financial situation, Doc. Like,
Hmm.
if my wife's not working, I don't know if I can take the time, right?
Okay. I could prescribe you something for the depression, but it's very important that you do not mix the medication with the alcohol. Can you do that?
I mean, you got get any advice as how to fix the money issue. Because I mean, I guess I don't know. I don't want to end up like my uncle. And I did it was nice, getting sober. Cleaned up my act, and that's how I met my
Hmm.
wife. But like, I'm worried about the whole financial situation. I'm the only one, doing this. I like,
So
how do I help that?
if I may suggest, if I may recommend therapy, individual therapy for you to help you cope with the life and the stressors around you. And I would also like you to recommend you family therapy to include your wife to be part of this decision making process. Like you said yourself, you don't want to lose her, and obviously she cares about you. Otherwise, you wouldn't be here today. She wants you
Yeah,
to feel better, to do better.
yeah.
So I think both of you would benefit from openly talking about this and going to therapy. And that way you wouldn't have to miss work. Would that be something that you could fit in your busy schedule?
Uh, if it's once a week, then or something like that, I could make some do. Do you
Great.
you think it's worth talking to her about getting a job? I haven't asked her because I just didn't think it was,
Hmm.
it's not it felt like admitting defeat,
Hmm.
But if you're really thinking I got to go to the detox, you think that's worth talking about, or
I would like to, yes, because I want to make sure that you come off of the alcohol safely. Okay. And the blood pressure is, do you have hypertension in your family? Diabetes
uh
runs in your family?
yeah, yeah. Both my parents, both my grandparents, they had it, and both hypertension and diabetes, and I guess
Diabetes.
guess I got that inheritance.
Yeah. So alcohol can cause hypertension problems, and especially when you come off of alcohol for, about a month or so, your blood pressure is going to be all over the place. It can be high, low, and but mostly in the high, a very, very high range. So that's why I would like you to be in a monitored inpatient detox facility where they check your blood pressure regularly. They assess your alcohol withdrawals regularly every 4 hours when awake. It's something that they call SIWA score. Okay, so it's done for to assess the severity of your withdrawals, and then based on the severity of your withdrawals, they medicate you, to help you get through that tough 10 days. Like you said in the morning, if you don't drink already in the morning, you're already waking up with the shakes and
Yeah,
and not really ready to start your day, and you have headaches and sweats and chills and sometimes nauseous and
yeah,
sometimes throw up and you blacked out several times. So those are all indications that you are drinking heavily and for a long period of time. But if you want to start off with therapy first, individual therapy for you and couples therapy, to get to a common ground, what can be done in this situation for your family, I think that would be beneficial. That way you won't have to miss work. And if it's once or twice a week, would that be something that you can do?
yeah, yeah. And if if the wife and I look at the pocketbook and we've got the funds, I guess I could do the inpatient thing. I just got to make sure that I don't screw the family over trying to take care of my mess.
Right. You mentioned you have Aetna insurance, right? So usually the insurance covers those things. You can give them a call. You can reach out to the insurance and see how many days that they cover. But just think about it this way: if you don't take care of yourself, who's going to take care of your family? Okay.
And
So in order
that's a
to
good point.
take care of them, you have to take care of start with yourself first.
Yeah, and I do want what's best for him. So
Yeah, of course. Um, I can help you setting up the therapy. I will send you the information for some therapists in the area that do individual therapy and couples therapy. Would you like me to prescribe you something for the depression to see if that
Uh,
could maybe help a little bit to maybe you would drink less?
I mean, you said I can't take it with the alcohol, right?
Right. Can you, right. So exactly. So,
So maybe we hold off, you
do
know?
you think you're able to stop on your own?
I don't know. I don't know, but like I don't think I'm gonna just stop cold turkey and start taking the depression meds,
Right.
right?
So those
So
two, exactly. That's why I was saying that we really need to get you off of the alcohol first safely.
yeah,
And
let me talk to the wife and maybe we'll do the treatment thing. If the insurance covers it and they'll be okay with me not working for a week or so, then
mhm,
maybe that's the way we go.
okay. And I would like to see you back in 3 weeks. If you want to bring your wife with you, that's totally fine. Just to see, if you guys made arrangements, if you reached out to the therapist that I'm going to give you, and if you started therapy, if you discussed with your wife about maybe going to an inpatient detox facility to see how you do with that.
Okay.
Would that be something you can do?
Yeah, yeah. No, you're all right, Doc. I wouldn't mind talking to you again.
Okay. Okay. When I can make the appointment now. It'll be 3 weeks from today, just to give you enough time to get situated, to have time to talk to your wife and at work maybe. Um, See if anybody in the family can help you with the children, when you're going to be there for about
Yeah.
7 to 10 days. That will, in 3 weeks, you have some time to get things situated. When would be a good time for your appointment? You like mornings or like noons, like today? What would be
Uh,
best for you?
we can do a morning one.
Morning, when the kids are in school, maybe.
Yeah, yeah. That way they're out of the house and they don't have to overhear anything that me and the wife talk to you about.
Hmm.
So.
Um, anything that I haven't asked, maybe that I should know about.
And I don't know. I don't think so. You asked about you asked about how I was drinking. You asked about the family. You asked about
Okay.
what I liked. I think you covered them all. No stone left unturned for you, Doc.
Okay. You said your anxiety was 0. That's why I didn't offer to give you anything for anxiety. But then again, it's really not good to mix medications with alcohol. You
Right,
understand? So,
right.
I want to help you. You definitely could benefit from something like an antidepressant, but, and we can discuss that once you're stable and off of the alcohol and stable, we can discuss all of that.
Yeah, I
What
think that's
options do you have? There's several antidepressants out there. I know you're young, you have a young family, so some of them, most of them have, as all the medications have side effects. So we can look at something that has the minimal side effects. One of the side effects, unfortunately, with antidepressant medication is uh, it gives erectile dysfunction and stuff like that. So, but there's medication out there with minimal side effects. Weight gain is also a concern, and since you said that you've gained about 10 pounds, so we can look at what options you have to make
yeah,
sure
yeah.
we
One
find the
thing at
right
a
fit
time,
for
Doc.
you.
One thing at a time.
Yes, exactly, exactly. Is there anything that you would like to ask me?
Um, do you think it's gonna get better? Do you think if I do this, it'll actually get better?
It will get better. It will get better.
All right.
You did it before. You did it before, and you can do it again. You can do it again. You just gotta, ask for help, and it's okay to ask for help. You're overwhelmed. I believe life is just happening, and like you said, if it's not a plumbing issue, it's something else. It's a tire or a car needs a battery. But life happens. Unfortunately, we can't put a hold on it. But it's okay to, and I know you want to be there for your family, and you want to be just like your dad and your grandparents, like the sole provider for them for it. But it's okay to ask for help.
All right.
And
All
you
right.
have to help yourself in order to protect them.
Yeah. Yeah. You're making sense. You're making sense.
All right. So um, I'm going to see you in 3 weeks, Mr. Smith, and I'm going to send you a follow-up email with the information for the therapists and their clinics, and you can reach out to them to make an appointment whenever it's convenient for you. And then in 3 weeks, we'll see where we at.
All
And you're
right.
more than welcome to bring your wife with you.
All right then. That sounds
Okay.
like a plan then, Doc. Sounds like a plan.
All right. Was very nice meeting you. And if anything changes, let me know. Call the office or email me. If something is so bad that needs immediate attention, please don't hesitate to call 911 or go to the emergency room. Okay.
Okay. All right.
Okay. But I'm available by email, by call, anytime.
All right then. All right.
All
I
right.
appreciate it.
Okay. It was nice meeting you, Mr. Smith.
Yeah, you as well. Have a happy Halloween.
You too. Thank you. Bye bye.
Bye.